that smile. Beautiful smiles from Dr. Dennis Nagata.
Hi, I'm Mauri, and today we're here talking to Dr. Dennis Nagata about sleep breathing disorder. Thanks for talking to me today.
You're welcome.
So I had a quick question for you. What is sleep breathing disorder?
Sleep breathing disorder is basically an obstruction of the airway during sleep. And people who suffer from this problem usually are very tired. They don't feel like they got a good night's sleep, and it affects their daily life.
Wow. So how does a person know if they have sleep breathing disorder?
Usually through your partner. Anybody who snores should assume that they have some form of sleep breathing disorder, and should actually see their primary care physician to see if they have a disease called sleep apnea, which is a total cessation or stopping of breathing during the sleep process.
Okay. So how would a physician treat?
Well, basically, if you have the symptoms of tiredness and sleepiness throughout the day, the physician will order a sleep test or sleep study, usually at a sleep clinic or in a hospital. And from there, they'll be able to watch your pattern in the evening, and they'll come up with data of how many times you stop breathing or you're restless during the sleep and it's been interrupted. And from there, the physician can do a proper diagnosis of either sleep apnea or simply just snoring.
And how would the physician then treat that patient?
Usually the first line of treatment is a machine called a CPAP, which is a continuous positive air pressure device that the patient wears with a mask that fits around the head. Unfortunately, many patients reject this type of treatment because it's so uncomfortable, and I've heard some patients tell me that it is even claustrophobic.
Wow, I can't imagine having to wear a mask when I'm sleeping. So as a dentist, do you have an alternative treatment that you could offer?
Dentistry has evolved to help people with this problem by utilizing a sleep appliance that holds the lower jaw forward. And when you are sleeping, usually the lower jaw falls back, and as a result, the tongue falls back too and obstructs the airway. And when you have this type of obstruction, it either causes snoring, and if the obstruction is severe, it'll actually stop the airway and the patient stops breathing. So with our device, what we're able to do is we're able to position the mandible or the lower jaw forward, and thereby allowing more air to pass through the airway during sleep. This is an example of the sleep appliance that we use to help people with obstructive sleep apnea as well as snoring. As you can see, there are fins on the lower model, on the lower teeth, that prevent the jaw from falling backwards. And by doing so, it increases the airway of the patient, and the jaw does not fall back, nor does the tongue fall back. So these are two separate pieces that the patient places in the evening, and my role in the treatment of the patient is to be able to adjust this device to their comfort and to their effectiveness. So utilizing a key and basically these gauges on the side of the appliance, we're able to adjust this piece forward, and thereby moving the jaw gradually forward to the point where the patient can tolerate it and it's in its most effective position.
That sounds like a great solution. How much would a device like that cost?
It ranges. Sometimes insurance are covering that. It's such a varied range depending on the type of device that is required. I would recommend people to come in for a consultation with a dentist to determine which is going to be probably the best device for them.
Okay, well, thank you so much. This sounds like a really serious problem that can be solved with dentistry, and thank you so much for sharing that with us today.
You're welcome.
Where did you get that smile? Beautiful smiles from Dr. Dennis Nagata.